Welcome to Thursday's edition of COVID-19. We've entered day 7 of our vaccination campaign, while our tally today remains little change from yesterday on the 400 level. We begin now with the pandemic updates with our Kwon So-ah. Now, so I understand there's been a slight drop in new infections compared to Wednesday.
A slight drop, so not a significant drop. If we take a closer look, we have 424 infections as of 12 a.m., so 20 fewer cases compared to yesterday. And with that, the number of domestic transmissions also remains in the 400s with 23 imported cases. And that raises the total here in the nation to 91,240, and the death toll stands at 1,619. With 7 people having lost their lives in the past day. Now, if we go over to our map now, we see 186 cases in Gyeonggi-do province. It's not as bad as yesterday, but still we have new infections in Gyeonggi-do provinces, Dongducheon, and also in Yangju, and those were detected at temporary screening centers set up for foreigners. Also, a triple-digit figure in the capital, Seoul, and infections here include cases linked to a daycare center as well as a restaurant. So daily cases are now lingering in the 300s and the 400s. So with that, Korea is still under prolonged third wave of the virus. And also, let's get a check on the number of vaccinations completed in the span of a week. Now we have over 154,000 people having been inoculated for COVID-19, and some 65,000 people have been vaccinated yesterday. And although vaccinations are in full swing, experts and authorities are warning of a fourth wave of the virus by the end of this month or in April. And also, Prime Minister Chung Se-kyun cited resurgences in nations that have got a head start in their inoculation programs. Let's take a listen.
In the case of Israel, which has the highest COVID-19 vaccination rate in the world, and the UK, which was the first country to start inoculating its citizens, we saw a 2.7 and 5.5-fold rise in caseloads, respectively, a month after vaccinations kicked off.
Right, let's hope for continued vigilance here in the countries. Other nations, so I hear, are struggling with people taking off their face masks.
Right. In the U.S. President Joe Biden has expressed his frustration at state governors who are lifting mask mandates. And Biden didn't hold back, saying this reflects, quote, Neanderthal thinking. And also, U.S. top infectious disease expert Anthony Fauci said that this is not the right time and it's ill-advised to lift the wearing of face masks. And in Japan, meanwhile, COVID-19 cases have rebounded to above 1,000. So Prime Minister Yoshihide Suga said a state of emergency in and around Tokyo is expected to be extended for another 2 weeks. And also, Japan's government and the International Olympic Committee are in discussion whether to exclude foreign spectators for the Summer Olympics. And now let's get a closer look at the numbers around the world. We are seeing a resurgence in cases, over 470,000 new infections in just 24 hours, and also an on-day rise in daily fatalities. And also, let's take a closer look at some major outbreaks here. The U.S. and Brazil are seeing the highest number of daily increases, some 85,000 here, and in Brazil, some 74,000. And also, we are seeing resurgences in European countries like France and Germany. And meanwhile, in Poland, this country has reported double the amount of infections on Wednesday compared to past Wednesday. So these are the updates I have for now, but I'll be back with more after the government briefing. Sunny?
All right, so thank you for now. Right, for an in-depth look at the domestic COVID-19 situation now, I have our Kim Ji-yeon here in the studio with me. Welcome, Ji-yeon.
Hello.
Right, let's start with how investigations have been launched into the cause of fatalities of a few people who had earlier received COVID-19 vaccines. Tell us more about this.
Sure, less than a week since Korea launched its massive vaccination campaign, health authorities say they're trying to determine if there's any link between the AstraZeneca vaccines and the 2 people who died shortly after receiving them. The Korea Disease Control and Prevention Agency said the deaths occurred on Wednesday, and both of them were male patients of nursing homes in the cities of Goyang and Pyeongtaek, respectively. A male patient in his 50s suffered a heart attack and had problems breathing after getting vaccinated on Tuesday. He had initially recovered after receiving emergency treatment, but died after another heart attack on the following day. Another patient in Pyeongtaek in his 60s developed a high fever and pentalgia, or pain all over the body, a day after being inoculated with the vaccine last Saturday. His condition improved slightly, but he ultimately passed away after suffering from pneumonia and sepsis on Wednesday. And this is what KDCA Commissioner Chung Eun-kyung had to say regarding the matter.
As of now, more than 200 million people have been inoculated worldwide, and individual countries are releasing their own analysis of documented side effects after around a month following the start of their vaccination campaigns. We're using that data as reference while at the same time reviewing individual cases to determine if there are any links between the vaccines and the reported deaths.
She added that post-inoculation deaths have also been reported in other countries, mainly among those with underlying health conditions. More than 400 deaths have been reported in the UK, while Germany reported at least 113 deaths after inoculation. But Director Chung stressed that there are no links that have been established between any of those deaths and the vaccines, certainly not from the Pfizer and AstraZeneca shots that Korea is currently using. Up until now, Korea has reported more than 200 cases of post-vaccination side effects, mostly light symptoms like headache, fever, and nausea. There have been only a few cases of serious adverse reactions, with anaphylaxis being reported in 3 vaccine recipients.
I see. Meanwhile, the military has also started vaccinating its service members, Chian.
Right. The first service members to get inoculated on Wednesday were the medical staff at the Korea Armed Forces Yangju Hospital. And the country plans to administer vaccines to a total of 2,400 medical personnel at 16 military hospitals by the end of this month. 2 of the hospitals in Seongnam and Goyang, designated as COVID-19 treatment centers, are getting the Pfizer vaccine, while the rest will be getting the AstraZenecas.
Right. And before you go, Chian, I hear the Defense Ministry is conducting extensive COVID-19 testings.
Right. A third case was reported at the Joint Chiefs of Staff Headquarters in Seoul, with the first case being confirmed last month. The Defense Ministry said some 130 people are being tested, and contact tracing efforts are underway, with a patient contracting the virus while on vacation in Seoul. This is an especially concerning development because it could impact the upcoming South Korea-U.S. joint military drills, which are scheduled to begin next week. The latest patient is an intelligence officer in the headquarters staff who is directly involved in the annual springtime exercise, which is expected to be shorter in length and scaled down this year, depending on the COVID-19 situation. The joint military exercise scheduled for March last year was postponed due to the pandemic, while the drills in August last year was held but conducted through computer simulations. The Korean military has reported 588 COVID-19 cases so far, with 23 still receiving treatment. Currently, 589 service members are in quarantine under health authority guidelines, with 22,549 others are placed in quarantine under the military's stricter protocols.
All right, Chian, as always, thank you very much for that coverage.
Thank you for having me.
Right, it's time now for the regular briefing on the pandemic situation here in Korea for this Thursday. Given the start of the new academic year this week, authorities are calling for greater public caution, even as vaccinations have been launched, highlighting the dangers of complacency. Having said that, do remember COVID-19 prevention measures have been extended for 2 more weeks here in the country until mid-March. The Greater Seoul area faces level 2 social distancing measures, while the rest of the country is under level 1.5. The ban on gatherings remains in place, with 5 or more people not permitted to meet for social purposes. An exception has been granted to immediate family members only, including grandparents, parents and children. Also, a few businesses, including movie theatres, internet cafes, video game arcades, cram schools, amusement parks, as well as retail stores, face no limit on operation hours. Meanwhile, restaurants, cafes, indoor gyms, singing rooms, party venues and indoor standing concert places can be open until 10 p.m. here in the metropolitan region, while those elsewhere nationwide face no time restriction. But all nightlife entertainment establishments, including bars, can only accommodate patrons until 10 in the evening. The briefing is about to start. We'll come back to you afterwards.
원장의 설명이 있겠습니다. Let us now begin our regular briefing on the COVID-19 situation here in South Korea for March 4th. As of today at midnight, we have a total of 401 new local infections and 23 new imported cases. With this, the total caseload now stands at 91,240. And a total of 63,457 tests were conducted yesterday. And at the makeshift testing centers in the metropolitan area, we carried out 27,760 tests. Among them, 64 people tested positive. And 462 more people have been discharged, while 7,459 people still remain in quarantine for treatment. And we have 11 more critical or severe conditions, and these number of patients stand at 140. We had 7 additional fatalities, and I extend my deepest condolences to the deceased and the members of the bereaved families. Here are some updates on our regional domestic cases. We have a total of 312 cases reported in the metropolitan area, about 77.8% of the total. And in other regions like Honam and so forth, we are seeing an on-week increase of new domestic cases. And in the metropolitan area, as for Seoul, in relation to the Yeongdeung-Pogu District restaurant, we have 34 accumulated cases. And in relation to a public sauna in Eunpyeong-gu District, we have 12 cases, and also 10 people from the Seoul Dongdaemun-gu District Hospital. And in Gyeonggi-do Province, in Dongjucheon City, in relation to the foreigners cluster, we have seen that at the temporary testing center, we have 7 additional foreigners being tested positive for the virus, and we are conducting our tracing as well as massive testing. And in Gyeonggi-do Province, Icheon City, in relation to a styrofoam factory, we have 12 accumulated cases. And in Seongnam City, we have also a bank with additional cases being confirmed, and also 12 cases from the Pyeongtaek's foreigners cluster there. And in Chungcheong area, in Chungcheongbuk-do Province, Jincheon, we have 26 in the meat processing factory, and also at another meat processing factory, we also have a total of 20 people. And in also at Daegu, we also have the college social gathering. We have identified a total of more than 20 people there. And Busan, in relation to a shopping center, we have 9 people. And in Seogu, in relation to a ship vessel, we have a total of more than a dozen of people. And in Gangwon-do Province, in relation to Wonju Fitness Club, we have 5 accumulated cases being confirmed to date. And next, we would like to provide you some updates on the new variants identified here in South Korea. After March 1st, we have looked into the 118 samples of the virus, and we have seen 16 new variants being confirmed. And after October until now, we have seen the new variants. The number of the new variants standing at 162 here in South Korea. Among them, 138 are the UK variants. And as for these 6 new variants, 6 new cases of the new variants, 5 of them were identified at the point of entry and 1 local infection. And as for this one person, we have seen that this is in relation to the Incheon-gu District, Incheon City's cluster infection. And we have seen that this person has been infected with the UK variant. And next, as for the safety e-reports, we also have some updates and the reports, cases of reports of breaches of these quarantine measures. And lately, we are seeing multiple reports related to cafes and restaurants. And we have seen that many people breached the mandatory ban on the private gatherings of 5 or more people. And also at construction sites, people did not wear their face mask properly. And also at cafes, there were reported cases of no social distancing practiced among them. And also, even after 10 p.m., the doors were closed. However, there were users inside. And due to the restaurants and cafes, due to the fact that people have to consume food or beverages, people are not wearing their face mask properly. However, once again, we urge you to always wear your face mask even if you are inside these cafes and restaurants. restaurants, and aside from the time when you are consuming food. And please abide by the social distancing measures as well. And next, we have some updates on our R&D as well as our therapeutics developments. And as for the remdesivir, we have administered the drug to about 4,833 patients here in Korea across 112 hospitals. And we have also administered the Reconora a drug to about 251 patients here in South Korea. And as for COVID-19 inoculations, here we have some updates as well. As of March 4th midnight, we had 65,446 more people receiving their inoculations. And now the total of recipients stand at 154,421. And the nursing hospitals, we have about 74,000 people getting their inoculations, which is about 35%. And also care facilities, we have seen that about 14,000 people have received the doses. And also as for the COVID-19 hospitals, we've seen that 2.7% of them have been inoculated, and about 141 first responders have received the COVID-19 vaccines. And we also have seen 512 new cases of adverse reactions being reported, and a total of 718 have been reported so far. And from them, 711 cases were mild symptoms, and the other 7 included the anaphylaxis reactions, and we also have 2 cases of deaths. And we are under investigation as for these post-inoculation deaths that have been reported. And moreover, after midnight, we also have some reports, and we have 3 additional deaths and 1 additional report of an anaphylaxis reaction. And first of all, I extend my deepest condolences to the deceased as well as the members of the bereaved families. And this person who was in his 50s, he was an inpatient at a nursing hospital, and this person has received the AstraZeneca vaccine, and after 41 hours since receiving the vaccine, he passed away. And B, this person also is in his 50s, a man, and also an inpatient at a nursing hospital. He has been administered with the AstraZeneca vaccine. However, after 15 hours, this person also passed away. And another report of the case is a woman in her 20s. And we have seen that this person has been an inpatient at a handicapped facility and a care facility. And we also identified that this person has passed away after about 10 hours since the inoculation of the AstraZeneca vaccine. And as for the person with the anaphylaxis reaction, this person is a woman in her 50s, and also after inoculation, this person had such allergic reactions after 10 minutes, and after treatment and medical intervention, she showed no symptoms, so she had returned back to the nursing hospital. And as for these reported deaths, we are under investigation, and please note that the details will be disclosed in a transparent manner. Starting from today, we also have the general hospitals, those over a certain grade and certain size will also roll out their vaccines. And as for the eligible list of people, about 300,000 people who have been eligible, and we have seen that about 214,000 people agreed to get the vaccines, which is about 88.5% of the total. And with this, we have been distributing the vaccines, and we will also provide these vaccines since March 3rd. And as for these hospitals, after the delivery, and starting from today until the next 5 days, they will be completing the inoculation. And the eligible people include the healthcare providers within their hospitals. And as for the COVID-19 treatment hospitals, starting from the 8th of March, we will be providing the vaccinations. And as for the hospitals that treat infectious diseases, these vaccines will be rolled out. And the first batch of these vaccines will be given to the doctors and nurses who treat COVID-19 vaccines, and other healthcare providers will be followed suit. And in relation to COVID-19, and especially in relation to inoculation, we have some words for the public. Here in South Korea, we are carrying out the inoculations in full-fledged, and after inoculation, we also have reports of other adverse effects and adverse reactions. And please note that COVID-19 inoculation is actually a core essence of combating the COVID-19 disease. And as you know already, over 200 million people across the world have been administered with these vaccines. And as for the advanced countries which have a very transparent monitoring of the post-inoculation reactions, there is a 0 case of post-inoculation death where the causal relationship has been caused by the vaccines. And we also see that these reported deaths are not indeed accidents. And we believe that these are the realm of the medical field and the scientific field. We are carrying out investigations and studies as well as analysis. And if we have any further results, we will be disclosing them in a transparent manner. And the inoculation, if you are also entitled to these inoculations, please also meet your doctor before your inoculation. And also, please visit the designated hospitals, and please have confidence in the inoculation. And here are also a few words about social distancing. And we have seen some foreign media reporting on a specific country in Europe which has been dubbed as a role model of quarantine. And in this country, we have seen more people receiving the COVID-19 vaccines compared to Korea. However, it is seeing another major resurgence of the virus, and an expert has cited 3 aspects for such reasons. First, it did not have a mask mandate for its people, and second, ahead of the Christmas holidays, they eased the social distancing measures, and third, also they did not have immediate reaction to curb the influx of new variants. We need to also learn from these models and shall not repeat such mistakes. And here in South Korea, every individual of the public are exerting their full efforts to wear their face mask and keep social distancing measures. And the quarantine authorities will also be basing on these principles, and we also have a flexible response to these COVID-19 outbreak. And if we have completed the inoculation of the high-risk group of people, we will also have more options at hand. However, right now, we still have many variables ahead of us. We have the possible resurgence of the caused by the new variant, and also second being the rate of the antibody development among our people. And as for the vaccines and herd immunity, we have some hopes in reaching these herd immunity. However, it is also not a time for us to stay complacent. Right now, we are on the long journey to overcome the COVID-19, and our scientific and medical experts have also great knowledge, and please have trust in them as well as in the government, and also continue to take part proactively in the inoculations. Moreover, we ask you to practice social distancing measures and wash your hands on a regular basis, and always wear your face masks. Please, once again, we urge you these aforementioned 3 aspects. And moreover, Mr. Chang Ik-chang, head of the Infectious Disease Center, we have some updates.
Right, there was Kwon Junuk with Thursday's afternoon briefing. So what did he have to say?
Well, let's begin with the general updates on new outbreaks in the country. There were new infections in the capital Seoul linked to a restaurant, a sauna, and a hospital. And some other major outbreaks are in Gyeonggi-do province. 7 more foreigners were confirmed with COVID-19 in Dongducheon. And as we know, that's where massive tests were conducted in relation to foreigners working in that region. And also also 2 separate meat processing factories have reported cases in the Chungcheong-do provinces, and also a shopping mall in Busan had new infections. And we also have updates on variants. 6 new variant cases were confirmed, which raises the total to 162 now. And out of the 6, 5 were from abroad, and 1 case was confirmed within the community, so a local transmission. And as of 12 a.m. this Thursday, Kwon mentioned that 3 people have died after getting their vaccinations, 2 in their 50s and 1 in their 20s, and the government is investigating the exact cause of their death. And there was also 1 anaphylaxis reaction after the vaccination.
I see, so. All right, thank you for that. I'll see you again tomorrow.
See you tomorrow.
Right, the new academic year began earlier this week following a turbulent year in 2020 that was marked by opening delays, an abrupt switch to distance learning and postponement of the National Scholastic Ability Test. Well, building on the lessons learnt last year, schools are seeking to minimize disruptions, that is, to their curriculums this time around. To take a look.
먼저 2021학년은 학사 일정은 개학 연기 없이 3월 2일부터 정상적으로 개학하고 법정 기준 수업 일수를 준수하며 운영하겠습니다.
Korea's Education Ministry has released its latest plan for the new school year, with in-person classes limited to 1/3 capacity in the capital region and 2/3 elsewhere. However, in light of the burden of childcare arrangements and college preparations, first and second graders, as well as high school seniors, will be allowed to attend classes on an everyday basis.
지금 이제 1년 이상 이제 그 코로나19의 유행 상황을 살펴보니까 학생들의 경우는 또 코로나19에 걸려도 증상이 경미하거나 없는 경우가 대부분입니다. 학교 방역 대책을 잘 지키는 경우에 학교를 매개로 이제 코로나19가 유행할 가능성은 매우 낮습니다.
This elementary school in northeastern Seoul is filled with the sounds of children returning for the new school year. First graders and their parents are streaming in for the school's welcoming ceremony for new students.
친구들이랑 잘 해보고 싶은 거 있어요?
책 읽는 거요. 운동장에서 달리기 하거나 아니면 점프하거나 농구하거나 할 것 같아요.
While students wait for the ceremony to begin, their parents are visibly on edge as they try to make sure their children are wearing their masks properly and keeping social distance.
오늘부터 우리 화랑초등학교 학생으로 입학함을 허가합니다. 축하드립니다.
The school is welcoming 120 new students this year, but only around 30 are taking part in today's event to prevent overcrowding. Although not everyone could take part in this occasion, it marks a dramatic improvement from the chaotic stop-start curriculum that students and teachers had to deal with last year. As part of the school's prevention rules, students and teachers have found a new way to communicate, using hand signs to exchange simple messages.
친구야 하면은 여러분이 반짝반짝 해보는 거예요. 선생님 친구야 해볼게요. 친구야.
Amid the tenuous return of in-person classes, some parents can't help but be worried about the safety of their children.
매일 등교를 하면 생활 자체가 좀 규칙적인 부분도 적응이 좀 될 것이고 좀 빠르게 될 것이고 아무래도 다중이 모이다 보면 위험도가 높아질 수밖에 없으니까 그런 부분에서는 좀 더 학교나 개인이 좀 방역을 조금 더 철저히 하는 것밖에는 방법이 없지 않을까.
Prevention is the key word, and the Education Ministry will be assigning extra staff members while providing face masks, disinfectants, and other supplies to keep schools free of COVID-19.
학생들이 학교 오기 전에 또 교직원들이 출근하기 전에 집에서 건강검진, 자가 진단을 실시해서 조금 더 이상이 있으면 등교하거나 출근하지 않도록 하고요. 각 교실마다 담임선생님뿐만 아니라 방역도우미 선생님들이 있어서 아이들이 마스크를 잘 착용할 수 있도록 잘 지도하고 있고요.
School teachers across the country will be vaccinated starting in July. Korean health authorities may decide to fast-track the timeline, however, given the fact that COVID-19 vaccines have not been cleared for use on children, with whom teachers come into contact with on a daily basis.
1학년의 경우는 선생님과의 관계 형성이 굉장히 중요한데 접종이 차질 없이 이루어진다면 아이들과 좀 더 가깝게 또 서로의 얼굴을 확인하면서 수업할 수 있지 않을까 기대합니다.
지금 당장은 학생들이 이제 접종을 할 수 없는 상황에서 코로나19를 주로 유행시키는 연령대인 학교 선생님들과 같은 교육 종사자들의 경우는 학생들의 안전을 위해서 코로나19 접종을 우선적으로 좀 해야 된다고 생각을 합니다.
The 2021 school year is now underway, and it is up to everyone to keep our children safe and provide them with the best possible education experience that our children deserve.
코로나19 예방접종 후 사망으로 신고된 2건 사례가 보고가 되었습니다. 역학조사 및 피해조사반을 개최해서 인과성에 대한 내용을 검토할 예정에 있습니다.
I think that Korean vaccine development has been a little bit behind the global trend. Korean vaccines that may have available some data on whether they're protecting against infection and are safe by the end of this year.
Amid the launch of public inoculations here on the local front, efforts are also underway to develop a homegrown vaccine. Now, for more on this endeavour and on the ongoing vaccination campaign here in the country, I have Dr. Alice Hyung-Tan from Ms. Medi Women's Hospital. Welcome back, Dr. Tan.
Thank you for having me.
And I also have Professor Justin Fendos at Tungseo University joining this session virtually. Good to see you again, Professor Fendos.
Thank you for having me.
Right then, Dr. Tan, authorities are seeking to offer the first dose of AstraZeneca's vaccine to 780,000 people and that of Pfizer's vaccine to 58,500 people within this month. Is this a feasible plan?
Right, so let's do the math. Today's March 4th. If we want to achieve that goal of vaccinating 838,500 people by the end of this month, that means that we will, on average, have to vaccinate about 27,000 people every day, 7 days a week, until the end of the month. Now, if we look at our results from yesterday and the day before, we had 65,000, more than 65,000 people vaccinated yesterday, more than 63,000 vaccinated the day before. So if our supply does not run out and our commitment among the people who need to be vaccinated stays high, then certainly this is an achievable goal. The challenge and the problem is what will happen in the second and third quarter of 2021, because that's when our mass vaccination campaign really needs to kick into full gear if we want to achieve herd immunity by the fall. At that point, we will need to vaccinate somewhere between 150 to 160,000 people a day. And that's going to take a lot of planning and coordination, determination, unity, a lot of encouragement, a big dose of good luck as well. But we do have plans for opening 250 vaccination sites across the country, along with 5 regional Pfizer vaccination centers. So I think this is ambitious, but an achievable goal.
All right. And speaking about Pfizer's vaccines, now these vaccines were administered here in the capital area starting last Saturday and then distributed to other parts of the nation yesterday. Now, why is it that Pfizer's vaccines are being rolled out in phases compared to AstraZeneca's, which were available from day one?
Right, I think it was just the fastidious nature of the Pfizer vaccine in terms of storage, delivery, the preparation and the administration of this vaccine. It's just a much more complicated and delicate procedure. And so that was the motivation for having this phased rollout. The first batches were delivered to the National Medical Center, which is a state-run hospital here in Seoul. It was also the primary training site for the administration of the Pfizer vaccine. So it did make sense to have the first batches delivered to the National Medical Center, and then going forward, the other regional centers will sort of learn from the experience, the good experience of that first rollout, the first few days, and hopefully there will be no complications going forward.
Hopefully. Meanwhile, Professor Fendos, in an article last month, you forecast that Korea would, and I quote, still be one of the first to be fully vaccinated. Now, this forecast comes despite our slow start when compared to countries like the UK and the US. Do you care to elaborate?
Sure, yeah. So looking at vaccination as a global phenomenon, the important rate-limiting step will be the international availability of vaccine supply. So most countries will have to be waiting in line with each other as vaccine supply becomes more and more available. And the countries that will be able to vaccinate their domestic populations quickest will be the countries that do not rely on the international supply, but can make use of their own domestic vaccine production. So these are countries like the United States and Germany. And South Korea is positioned quite advantageously to become more like Germany and the United States rather than other countries because of a number of reasons. The first reason has to do with the fact that South Korea over the last decade or so has developed a very large and very advanced pharmaceutical industry. And this industry has been particularly competitive in the area of generic drugs. And so a lot of the expertise and a lot of the infrastructure that you need to domestically manufacture vaccines, Korea already has. Second advantage has to do with licensing agreements. So starting very early in the pandemic, in the summer of last year, the South Korean government was very aggressive in trying to connect its domestic vaccine manufacturers with foreign vaccine companies like Pfizer and AstraZeneca so that Korean companies could acquire the licenses to make those foreign patented vaccines. So these two aspects, the capacity to make as well as the licensing agreements to be able to make them, these two things put Korea in a very unique position to supplement a lot of their international vaccine imports with domestic vaccines that they can make.
I see. Staying with that, Professor Fendos, do tell us a bit more about the merits of having this manufacturing capacity of vaccines.
Right. So as I just mentioned, the biggest advantage to having domestic vaccine manufacturing is the ability to vaccinate your population faster. But there are also some other advantages associated with it. One of these advantages has to do with quality control. So if you are, for instance, Spain or the United Kingdom, you're essentially importing all of your vaccine. And so you may have some oversight and some ability to assess the final product, but you really have no control, no oversight over the manufacturing process itself because that's taking place in another country. So if you can manufacture your own vaccine domestically, your government has much greater oversight, much greater control over the manufacturing process itself. And that can allay fears about things like safety and other guidelines that you would like those vaccines to follow as they're being made. Other benefits that happen a little bit more long-term have to do with the potential for exports. So if you are making vaccine domestically and you've satisfied domestic needs, any additional vaccine that you make can then be exported, and that is economically advantageous both for the companies as well as the government of that country.
Right. Meanwhile, Dr. Dan, related authorities here also appear determined to develop a homegrown vaccine. Why is this endeavor so important?
Well, we learned back in 2009 during the H1N1 pandemic, sort of the hard way, the importance of having a domestically available vaccine. So the H1N1 pandemic started in April in North America. It reached our shores in May. But it wasn't until October, November that we actually had a vaccine available for our population. And we went through what I call a very painful experience of going abroad, overseas, to negotiate, request vaccines, and we were repeatedly denied, and we had to return empty-handed. And it wasn't until we had a domestically produced vaccine that we could start our vaccination campaign in October. And by November, that's when we started to see a dramatic decrease in the incidence of H1N1 influenza. So that was our real life experience, and I think we've learned from that. Fortunately, during COVID-19, we have mechanisms such as the COVAX facility, and also there's just been a huge effort to make sure that the global population is protected against COVID-19. And so even though we do not have a domestic vaccine developed yet, we were still able to have a made in Korea AstraZeneca product roll out relatively early if we look globally. And so I think that's why we need to concentrate on having a domestic product. also, if you look at the long game, 2021 vaccinations will be just round one of potentially many rounds of vaccine going forward. So not only will we need more vaccines in terms of quantity, but we will most likely need new vaccines in terms of tackling variants that will be that are emerging and will continue to emerge. And so that's multiple reasons for why we need domestic vaccines.
Right, and staying with what Dr. Tan has said, Professor Fendos, I understand local vaccine development efforts also seek to tackle variants. Could you tell us more about this, please?
Sure. So I think it's important to clarify when you're talking about homegrown vaccines, whether we're talking about domestically manufactured AstraZeneca, Pfizer, or if we're talking about Korean vaccines that are being invented in Korea, so actually new vaccines. So if we're talking about the latter type, as far as I'm aware, there are only 4 vaccines in the pipeline that are in clinical trials at this moment. And the companies involved are SK Biosciences, Genexine, Celid, and Gene1. And as far as I'm aware, none of these has passed phase 2 trial yet. So what that means is if you want to reach the approval step of actually being able to distribute these vaccines to the population, we're looking at a time scale of several more weeks on the very optimistic end to probably a lot more months. And so for the immediate concern, as Dr. Tan correctly indicated, for the immediate term for 2021, Korean homegrown, Korean invented vaccines are essentially sidelined for most of this year. And if we do enter a phase where we need new types of vaccines next year and in future years, there is some opportunity for them to come back and participate. But for the current situation, for this first wave of vaccination, I think it's almost impossible for them to have any meaningful effect.
I see. Dr. Tan, the goal of the inoculation campaign right now is to vaccinate at least 70% of the population for herd immunity by November. Now, the concern is that this goal will essentially leave us short, that is, of potential volunteers for clinical trials of our own vaccine candidates. What are your thoughts on this?
Right, so you are pointing out a real challenge that we may be facing in that we are trying to recruit participants for phase 1, phase 2 trials. We haven't even started any phase 3 trials of domestic vaccines and treatments. And we're doing this in the midst of a mass vaccination campaign. And so we may face the real life problem that happened in South Africa, in which they were trying to do one of the arms of the AstraZeneca vaccine trial, phase 3 trial down in South Africa. And what they found is 14.5% of the volunteers who wanted to participate in the trial were already seropositive for SARS-CoV-2 virus. In other words, they had already been infected. They didn't know it, and they tried to participate in the trial, but of course they were ineligible, and that led to very low numbers of participants in South Africa. There was, moreover, the issue of the variant, the B.1.351 variant down in South Africa, not being effective against AstraZeneca vaccine. And so they had to halt the rollout of the vaccine down in that country. And so there are multiple challenges ahead, and we may, face some problems. Now, if we're targeting variants, it may not matter so much, because our population, we don't have widespread variants. So people who would have been infected and people who are getting vaccinated, they will have immunity to the wild type and the D614G variant, but not against the newer variants, which we may need to trial.
Right. Professor Fendos, what government support is essential to ensure success in vaccine development here in the country?
Right. So again, I think whether we're talking about vaccines that are foreign patents or domestically invented vaccines, I think the answer is a little bit different. For the near term, as I was saying earlier, I think if the government wants to put any support and any money into vaccine production and manufacturing, it's probably better to put it in the former category of those license agreements of trying to repurpose Korean infrastructure so that you're producing vaccines that have already passed all 3 phases of the clinical trial and can be made to the public quickly. But there is merit to doing a more long-term approach of investing in Korean vaccine companies so that they're better able to quickly invent new vaccines if we get prolonged COVID pandemic or if we have the next pandemic. So both types of support are useful, but I think it's important to be clear about, what time scale is the support that we're talking about for? Is it for the near to immediate term, or are we thinking more long term? And based on that answer, I think, the usefulness of that support becomes pretty obvious.
Right. Meanwhile, one final question, Dr. Dan. There have been a few unfortunate cases of fatalities, of patients, that is, at long-term care facilities having received COVID-19 vaccinations earlier. Now, authorities are looking into the causes of these fatalities, but what are your thoughts so far?
Well, let's look overseas. Over in the UK, as of February 14th, 6.9 million people received the AstraZeneca vaccine. There were 205 deaths reported after the vaccination, but none of them were linked to the vaccine itself. In other words, none of them were caused by the vaccine. If you look at the rate of fatalities, it's roughly 1 death for every 33,000 people who are vaccinated in the UK, and that's roughly what we're seeing here in our country right now. I think what we need to do is wait and see, what was the cause of death. Was the vaccine involved in any way? And once we have that answer, I think we will be able to move forward with confidence. And most likely it will be that these were just temporal relationships, not causal relationships. And I think it's early for anyone to try to jump to any conclusions.
Right. All right, Dr. Dan, as always, thank you very much for your thoughts. And Professor Fendos, thank you very much for your time today.
Thank you.
Right, to a certain extent, the presence of this initial uncertainty over the vaccination campaign is understandable as it is in its early stages. Yet, as our panelists have been saying time and time again, do seek to equip yourself with accurate information to allow for a safe path out of this pandemic. Thank you for watching.